Hello and welcome to Pregnancy Info. Today we are going to discuss the vitamin D deficiency, symptoms, treatments, causes, and more. Vitamin D is an extremely important vitamin that has many important functions throughout your body. Unlike other vitamins, vitamin D functions like a hormone. Many cells in your body have a receptor for it. Your body makes it from cholesterol when your skin is exposed to sunlight. It's also found in certain foods such as fatty fish and fortified dairy products. Though it's very difficult to get enough from your diet alone, the Endocrine Society recommends that most adults get 1500 to 2000 IUs of vitamin D daily. Signs and symptoms of vitamin D deficiency we will discuss in this video, but first of all, we will tell you that why is vitamin D so important. There are 7 key benefits of vitamin D with these nutrients potentially happening with bone loss, cancer prevention, depression, type 2 diabetes, cardiovascular disease, weight loss, multiple sclerosis or MS. Vitamin D deficiency is very common. It's estimated that about 1 billion people worldwide have low blood levels of the vitamin. According to the review, 41.6% of adults in the United States are deficient. This number goes up to 69.2% in Hispanic adults and 82.1% in African American adults. Now, we will discuss the symptoms or the signs. Here are some signs and symptoms of a vitamin D deficiency, like being sick or getting infections often. One of the vitamin D's most important role is keeping your immune system strong, so you are able to fight viruses and bacteria that cause illness. It directly interacts with the cells that are responsible for fighting infections. If you're often being sick, especially with colds or flu, low level of vitamin D may be a contributing factor. Fatigue and tiredness. Feeling tired can have many causes and vitamin D deficiency may be one of them. Unfortunately, it's often overlooked as a potential cause. Case studies have shown that very low blood levels of vitamin D can cause fatigue that can have a severe negative effect on quality of life. Vitamin D deficiency can cause fatigue and sleep quality have been also researched in children. In a study including 39 children, low vitamin D levels were associated with poor sleep quality, shorter sleep duration, and delayed bedtimes. Bone and back pain. Vitamin D helps maintain bone health in a number of ways. For one, it improves your body's absorption of calcium. Bone pain and lower back pain may be a sign of inadequate vitamin D levels in the blood. Depression. A depressed mood may also be a sign of vitamin D deficiency. In review studies, researchers have linked vitamin D deficiency to depression, particularly in older adults. In an analysis, 65% of the observational studies found a relationship between low blood levels of vitamin D and depression. Impaired wound healing. Slow wound healing after surgery or injury may be a sign that your vitamin D levels are low. In fact, results from a test tube study suggest that the vitamin increases the production of compounds that are crucial for forming new skin as part of the wound healing process. Vitamin D plays a crucial role in calcium absorption and bone metabolism. Many other people who are diagnosed with bone loss believe that they need to take more calcium. However, they may be deficient in vitamin D as well. Low bone mineral density is an indication that your bones have lost calcium and other minerals. This places older adults, especially women, at an increased level of risk of fractures. Hair loss. Hair loss is often attributed to stress, which is certainly a common cause. However, when hair loss is severe, it may be the result of disease or nutrient deficiency. Hair loss in women have been linked to low vitamin D level, though there is a very little research on this to date. In particular, research suggests that low vitamin D levels are linked to alopecia areata and may be a risk factor of developing the disease. Muscle pain. The cause of muscle pain are also often difficult to point out. There are some evidence that vitamin D deficiency may be a potential cause of muscle pain in children and adults. In one study, 71% of people with chronic pain were found to be deficient in the vitamin D. Weight gain or obesity is one risk factor of vitamin D deficiency. There is also research that indicates that vitamin D deficiency may increase the risk of weight gain too. Anxiety. As with depression, there may be linked between vitamin D deficiency and anxiety disorders. According to one review, level of calcidiol, a form of vitamin D, was found to be lower in people with anxiety as well as those with depression. Now we will discuss the treatments. Treatment for vitamin D deficiency primarily consists of supplementations. If your doctor determines that you are indeed lacking this nutrient, they may recommend the following options. Number 1. Supplements. A vitamin D deficiency may be treated with vitamin D supplementation. You may find these easily over the counter, but you should ask your doctor for specific recommendations to ensure the right dosage. Natural remedies. Aside from vitamin D supplementations, your doctor may recommend adding more vitamin D-rich foods to your daily diet. Options may include fatty fish, egg yolk, fortified cereals, milk, juices, and added vitamin D, yogurt, beef liver. Since sunlight is also a source of vitamin D, your doctor may recommend going outside more often. However, given the negative effect of too much ultraviolet exposure, you must follow your doctor's instruction carefully. Now, what are the causes? Having vitamin D deficiency is defined as having blood levels below 20 ng per milliliter. There is no single cause of having this type of natural nutritional deficiency, but your overall risk may be linked to certain underlying conditions as well as lifestyle factors. Here are some of the most common risk factors for vitamin D deficiency: having dark skin, being an older adult, having overweight or obesity, not eating much fish or dairy, living far from the equator in areas where there is a little sun year-round, always using sunscreen when going out. However, using sunscreen is important in helping prevent the sun's damaging effects to the skin, including skin cancer. Staying indoors, having chronic kidney diseases, liver disease or hyperparathyroidism. Having a health condition that affects nutrition absorption such as Crohn's disease or celiac disease. Having gastric bypass surgery. Using certain medications that impact vitamin D metabolism such as statins and steroids. When to see a doctor? Most people do not realize that they are vitamin D deficient. They are vitamin D deficient as symptoms are generally subtle. You may not realize that easily, even if they are significantly affecting your quality of life. As a rule of thumb, you may consider asking your doctor to check for vitamin D deficiency if you notice any possible symptoms and have any risk factor. They check your vitamin D levels with a blood test. Your doctor may also help rule out other causes behind some of the symptoms you're experiencing. How much vitamin D you need? In healthy people, the amount of vitamin D needed per day varies by age. The chart shows the often cited recommendations for the Institute of Medicine's, now the Health and Medicine divisions of the National Academies of Sciences, Engineering and Medicines. It is important to know that these are general recommendations. If your doctor is checking your blood levels, he or she might recommend higher or lower doses based on your individual needs. A vitamin D supplement containing anywhere between 800 to 2000 IUs daily, which can be obtained without a prescription. It can be safe and beneficial, so you can ask your doctor for these. Infant of 0 to 6 months need 400 IU per day. Infants of 6 to 12 months, 400. Children 1 to 3 years, 600. 4 to 8 years children, 600. People 9 to 70 years need 600 per day. People over 70 years need 800. Females 14 to 50 years old need 600. So these are the units you need. Can medications cause a vitamin D deficiency? Yes, vitamin D levels can be lowered by certain medications. These include laxatives, steroids, cholesterol-lowering drug, seizure control drug, a tuberculosis drug, a weight loss drug. How is a vitamin D deficiency diagnosed? Your doctor can order a blood test to measure your levels of vitamin D. There are two types of tests that might be ordered, but the most common is the 25-hydroxy vitamin D, known as 25-OHD for short. For the blood test, a technician will use a needle to take blood from a vein. You don't need to fast or otherwise prepare for the type of test. How often do you need to get your vitamin D level checked? Doctors do not usually order routine checks of vitamin D levels, but they might need to check your levels if you have certain medical conditions or risk factors of vitamin D deficiency. Sometimes vitamin D levels can be checked as a cause of symptoms such as a long-lasting body aches, a history of falls or bone fracture without a significant trauma. So, in this video, I have explained all about vitamin D deficiency, its sources, treatments, symptoms, and all about. If you find this video useful, then share it with your friends and family members, and also subscribe my channel. And you can give your precious opinion in the comment section. Thank you.